Hello， 大家好，欢迎来到洛杉矶华人资讯网的直播现场，我是主持人莉亚。今天我们要聊的呢是一项正在改变美国视力矫正领域的新技术，特别适合45岁以上有近视眼、老花眼还有散光的朋友。那很多人都听说过啊，就是在美国可以做这个老花眼的晶体置换，但是呢，有一些人做完之后呢，都会有疑问说，为什么我手术做完了，视力还是没有能够完全看到100%的清楚？那传统的人工晶体的确可以矫正老花眼还有近视眼，但是呢，由于每个人的眼部条件不太一样，还有呢可能会出现术前测量的误差、角膜愈合的状况有差异等等，因此呢结果总是不能够那么尽善尽美，甚至有一些人在手术之后开车或者是看书还需要戴眼镜。那么有没有一种可能，就说这个度数能够在术后还能够继续微调，让你视力的清晰度更加接近于量身定制呢？今天节目也要介绍的这个最新的技术，就是专门为这个问题解决而诞生的。我们非常荣幸邀请到的是 LAL Light Adjustable Lens 方面的专家，来自 iqlaser Vision 北加诊所的 Dr. Jack 田参与到节目当中。Dr. Jack 田，他是华盛顿大学临床助理教授，在处理45岁以上人群的视力问题方面经验非常丰富。我们首先请 Dr. 田给大家打个招呼吧。Hi, Dr. 田 Thank you so much for joining us today.
Hi, Leah. Thanks for having me back.
Great. So we had you before, but we still wanted to introduce you to a new audience. First, could you please briefly introduce yourself?
Of course, yeah. My name is Jack Tien. I'm an eye surgeon. I work along the West Coast from San Francisco, LA, all the way up to Seattle and Portland. I do ROE surgeries, cataract surgeries, and ICL surgeries.
That's wonderful. So we talked about the refractive lens exchange last episode, and we talked about several lens options. Basically, you can correct your nearsightedness, presbyopia, especially for people who are over 45 years old. And you mentioned a very special technology. It is light adjustable lens. So what it is and why it is so phenomenal, and what is the differences between LAL lens from multifocal lenses?
Great question. Thanks, Leah. Yeah, the LAL lens is a very special lens. We'll just backtrack a little bit about where this lens comes from. So, never have we had a lens that we're able to adjust after surgery, get it just right, perfect fit for your eye, so that most of our patients see 2015 and this is better than 2020. So let's talk about where this lens comes from. So this lens was born between LA and San Francisco. So two really clever doctors, they won the Nobel Prize for this technology where they can embed a macromer inside of silicon, and they can then adjust it with UV light by shining UV light at it. So now we have this lens that we can implant into your eyes, and then we can check if there's any residual glasses error, and then we can use the UV light over the course of several weeks to get all of that out, so that you have no what we call residual refraction or need for glasses after the surgery.
That's really wonderful. I mean, so with LAL, you mentioned about the UV light treatment after surgery to adjust the power. That's basically the golden nuts. And so usually, how many adjustments are typically required, and how soon can patient expect to see clearly?
Great question. Yeah, you got it just right. That's the question. And this is a slow process. So if you can imagine, if we do a multifocal lens, a fixed lens, it has all that range built in. You're seeing really well the day after surgery. So you're reading, you're seeing distance, everything's great. This lens the focus is quality. So the expectation is, we're going to put in these blank lenses into your eyes. They'll get your distance vision quite good. I would say most people are 20/20 for the distance, but they haven't been customized to your eye yet. And so we wait. We put them in. We put both eyes for distance. You won't be reading very well for that first month. And we wait for 1 month. That way, this lens settles into its final position inside your eye. As you can imagine, if we put a lens in, sometimes during the healing process, and this is unrelated to the surgeon, but really just the way you heal, that lens may move forward a little bit, it may move back a little bit, it may rotate a little bit. So then it throws off your refraction afterwards, or your need for glasses, you may end up with a need for glasses. And so we really want to wait for that process to settle out before we start adjusting that lens. Otherwise, we're really chasing a moving target, and you don't want to do that. You want to get it just right. And that's the reason why this process takes about 2 months. And Leah, your great question, how many adjustments? Typically, there are 3 adjustments. The first adjustment, we really want to hone in on your distance vision, get that just right, get your astigmatism corrected, get your vision in the distance as good as we can get it. And then on the second and third adjustments, we can do a little bit of both. We can get your distance vision even better if you need to, and then we can also start to pull in for your near vision so that we can get your near vision as good as we can get it. And certainly you can have your near vision as good as you want it to be. That lens can get your near vision seeing well from the tip of your nose if you wanted to. But of course, if you do that, then your distance vision in that eye is going to be very blurry. So we'll help you come up with the best judgment for how to customize your vision such that you're not using glasses for near all the way out into the distance without going overboard and getting your near too good and sacrificing your distance vision. So it is a process, and you just have to trust us and be patient with us. Everybody gets there at the end of the day.
Wow, that's a wonderful explanation. I mean, that's exactly the answer what I'm looking for. So basically, the patient can get the best quality of the distance vision right after surgery, and then waiting for 3 weeks for a healing process, and then pulling back the reading vision in the first or second adjustments. It's just because you don't want to lose the target. You just wanted to target one thing during the procedure and during the recovering process. So that's wonderful. But nowadays, people actually spending more time on their phone. People always on their phone. So during this recovering process, would you giving them reading glasses just to help them to see clear on their phone until they get their perfect reading vision?
You bet, Leah. Yeah, great question. So you'll be provided with a set of glasses. Among them, one pair will be for reading. These glasses that you get are just for outdoors, right? There's UV light outdoors. The only UV light we're ever exposed to really is from the sun. And so, you can use those, but it might just be more comfortable. Most of us do our reading and our computer work indoors, where we don't need to wear these special UV glasses. So it may just make sense for you to go to the drugstore and purchase a pair of $1 reading glasses. Purchase a few different powers. You can go to the store, try some on. Put your book at where you most comfortably read, and then just buy a few of those pairs. For that first 2 months while you're being adjusted. I think that's a good option.
Great, that's wonderful. And also, people are interested in new technologies, but they also worry about are they being testified? Although it's FDA approved, but since it just came out for almost 2 years, are there any experience on that? Any side effects or risk people should know before the surgery?
Great question, Leah. So yeah, the FDA process is long and arduous, right? The Nobel Prize was awarded in 2001. FDA in America approved the light adjustable lens in 2017. So we're about 8 years now. I've used this lens personally for about 5 years. It's been out there for a long time. In Europe, it came out even sooner. So we have, I think probably at this point, more than 10 years of data on this lens. The big questions typically are, once you've locked in this lens, will it drift? And the short answer is no. It's locked in. It'll be that way for the rest of your life. The whole point of this lens is you do it once, you do it right, and you never have to have surgery again for the rest of your life. So it's a forever lens. So yeah, really, there's not too much risk. And it's not very new. I think for our Asian audience, maybe it's not available in China. So maybe for our Asian audiences, it sounds new, but no, we've had it for a long time. It's worked great. We're even on our second generation of these lenses, light adjustable plus lenses now. So that tells you usually there's a more than a 5-year gap between the different generations from the same company.
Oh, great. So what new features for the LL Plus?
Yeah, there's some new features. I think the LAL Plus is an interesting lens. They designed a little bit more range into it, and the idea is, maybe that will shorten the amount of adjustments. Maybe instead of having 3 adjustments, it's now 2 because you already have a little bit of range. I personally just use the LAL Original. I think that's a tried and true lens. It's really almost never fails. The LAL Plus, I think it's a great lens. I'm just waiting for more data on that.
That's wonderful. So people still wanted to know, by the age of 45, they have like a light adjustable lens, and probably when they are 80 years old, there will be more eye condition happen, like floaters or some retina problems. Are they still be able to get these treatments even after the refractive lens exchange, or it will be more difficult for them to treat their eyes after the procedure if they have other eye conditions?
Great question. So I'll dive in a little bit deeper on this one. So the light adjustable lens is, as you know, is a silicon lens, and it uses UV light to treat. So there are eye conditions where UV light is not a great idea. So I'll name a few. One is if you've had an infection in your eye called herpes simplex or herpes zoster. Any of the herpes conditions can be reactivated with UV light. Other conditions, any kind of inflammation in the eye in the past, UV light can trigger that again. UV light also causes scar tissue to form robustly and quickly. So often, once we're done with treatments, we can have a quick onset of scar tissue formed behind the lens itself. This is inevitable with any lens. You will have scar tissue forming, and you'll need for us to adjust those out for you with a typical laser. But with the LAL, it tends to come a little sooner, within a year or so. And then you're talking about retina. Typically, there are no effects on the retina, and that's because the FDA approval for this lens is you can't have the UV light travel past this lens. You absolutely can't have that, right? Right. It's not safe. So on the back surface of this lens, you have this 100% UV coating, so that whatever adjustments we're making on the lens, it doesn't go beyond the lens itself. And that's been proven in the laboratory. Very robustly.
Got it. So for Asian patients, definitely it's a new thing, and just like you said, it's not that new. Actually, you have done this for several years. So tell me one most common misconception or understanding regarding this lens, based on your experience talking to patients.
Okay, I think one thing you want to be really aware of that we always test before doing this lens is, can you accept your eyes being a little different from each other? Very rarely can you set this lens for distance and expect really good near vision, right? Both eyes for distance and expect that's multifocal lenses. That's a different technology. This lens requires a 0.5 to 1 diopter difference between the two eyes, typically, for you to be out of reading glasses and distance glass, everything. So you want to establish with your doctor prior that if we, offset your eyes by about, 3/4 diopter, can you function? And do you even notice that? So if you don't notice that, which is, the vast majority of patients, then I think it's a great technology. You should do it. But if you feel like that fogging when we put the plus 0.75 in front of your non-dominant eye, that it throws off your distance vision in your other eye, then you may want to think twice about doing the surgery. But yeah.
Got it. So would you stimulate the process in the office just to help people to understand what is the monovision or blunt vision? Will they like it? Or are there any ways they bring the contact lenses back to home to feel it in their daily life? How does it work?
Yes, absolutely. All of the above, or one of the above. So typically for monovision LASIK, ICL blended vision, and RLE with LALs, we will trial frame the patient simply just by putting a plus 75 lens over their best corrected distance vision, and see if that affects their distance vision. And if not, then all good. You can proceed with surgery. It should not, you should have a great result. If it does impact your vision, you may want to then do a longer trial. See if you can adapt to it over the course of a week or so we can send you home with some contacts or, trial frames. And you can let us know if that works for you. If not, then perhaps, blended vision is not a good solution for you. I would say that's pretty rare though. Maybe 1% of patients have what we call codominance, which means the two eyes work really well together and have to be in sync with each other for all of this to work out. But that is the the minority of patients. The other thing you want to consider is, are the two eyes equally good with vision? So have equal potential in their vision. Some patients have a lazy eye that they may or may not be aware of, an eye that just doesn't see as well as the other eye. So in that case, blended vision may not work very well for you too, because you're really relying on the two eyes to do different things now. And if one of your eyes is, quote unquote lazy, well, then the whole system's not going to work very well. So again, these are all, questions that are very, very personal to the patient that we'll tease out at your consultation with us, and we'll recommend then what's the best option. Maybe for those patients who are codominant or have a little bit of amblyopia, we choose not to pursue blended vision and to try our best at multifocal lenses.
Got it. A lot of people actually had their surgery like 20 years ago with LASIK, so would be LAL a great surgical options for them since it can be adjusted power? Because a lot of them maybe have the presbyopia but not myopia, because you're talking about it's a trade-off to have your one eye see distance and one eye see near. So what is the vision result for them? Will they be good candidates?
Oh, absolutely. I almost reserve the LAL for such cases. LASIK and the procedures that predate LASIK tend to cause a little bit of aberration on the cornea. These aberrations or these unnatural shapes of the cornea tend to make judging what's the best lens power to fit into the eye a little more difficult. So we tend to be a little more off target for such patients. So just to summarize, if you had prior eye surgery, corrective eye surgery in the past, choosing a fixed lens is going to be a higher risk of us being off target. So that's the benefit of the light adjustable lens, right? Is that even if you're off target, it's an adjustable lens. That the whole point of it is you can adjust it to whatever the patient needs inside their eye. So it is literally the final surgery that you'll have, regardless of whatever you've had in the past with your eyes. With fixed lenses, then yeah, you may need to, if you're off target, have some more LASIK done or a lens exchange. Typically bigger surgeries. But with the LAL, you're not going to have any more surgeries. We can adjust that lens inside your eye.
That's wonderful. So how much does it cost?
Well, that's a good question. It depends on where you live. I've seen it cost somewhere like $20,000 in LA. Everything tends to be more expensive in LA on the West Coast. But I think a typical price for it north of LA is about $15,000 for the two eyes, typically done together. You really, the LAL, you want to do them together. Again, remember the two eyes are adjusted relative to each other, because you have you're going to have a distance eye for distance intermediate and a near eye for intermediate and near. You don't want to do them separately, because then you're coming in too often and it's going to be a lot of trips, especially in LA when you have so much traffic. So I would say almost always do both eyes together, get it adjusted relative to each other, and you're going to have a great result.
That's wonderful. I learned so much from you today. It's very, very informative. Thank you so much for joining us today. And actually, iqlaser Vision 的创始人林殿凯医生呢，他的自己爸爸妈妈都有做这项技术。那同时呢 ，Dr. Jack Tian 的 dear friend iqlaser Vision 在 Houston 的医生 Dr. Mattioli， 他也在2023年做了 light adjustable lens， 也是他自己亲自植入了这款晶体。所以真的是目前就是美国最新的技术。因为你想，他术后还能再调整3次，还能错到哪里去呢？所以对于那 那些真的是希望能够达到自己视力达到一个非常满意水平的朋友，那这个 LAL lens 呢，实际上应该是您的第一首选。主要呢也是看您的眼睛能不能够适合这样的混合视力这种方式。重点呢还是要来诊所做一次免费的咨询，检查一下。那在诊所的时候呢，会为您进行一个视力的模拟，来看看您是不是喜欢这样混合视力的感觉。然后呢，同时呢也会为您谈及更多有关于24个月免利率分期的 payment plan 的这些 detail。那如果你算下来未来30年都能够看清楚的话，其实基本上每天只需要花1块钱，那真的是比买一杯咖啡还要便宜很多啊！就这样算下来，基本都没有什么感觉了。那同时大家如果感兴趣的话，可以扫描屏幕上方的二维码，我们请老师来放出来一下，可以扫描二维码，并且添加 iqlaser vision 的微信号 iqlaser， 我们提供24小时每周7天的全天在线的这样的一个中文客服，帮您来约咨询，同时呢回答问题。那 Dr. Jack 田呢是非常经验丰富的医生，他在北加诊所会有这样的一个手术的一个计划。如果您想找 Jack 田医生来做手术的话，就是去找北加诊所就好。如果你在休斯顿的话，他应该也可以过去来帮您去做手术。那以上的今天节目的全部内容了，非常感谢今天邀请到 Dr. Jack 田来参加我们的节目。Thank you so much, Dr. Jack 田 for joining us today.
Thank you, Leah. Thanks for having me.
Yeah, great. So I'm looking forward to talk to you next episode. See you soon.
See you soon.
Bye bye.